Hey everyone and welcome. Today we're going to take a tour of something you've definitely experienced but maybe never really had explained to you, the world of dental x-rays.
You totally know what I'm talking about, right? You lean back in the chair, they bring out that heavy lead apron, and then comes that little sensor thing. First, they take one kind of picture, then maybe another. It can feel a little random, but I promise there's a very, very specific reason for every single image they capture.
And really, this is the core idea for today. Just think about it for a second. Your dentist can only see the surfaces of your teeth, what's visible, but so much of what's going on with your oral health is hidden. It's below the gum line, it's in between your teeth. X-rays, or radiographs, are basically the superpowers that let them see what the naked eye just can't.
Yeah, it's kind of like a mechanic's toolbox. You wouldn't use a giant wrench for a tiny screw, right? Well, a dentist doesn't have a one-size-fits-all X-ray. Each different type of image is designed to answer a very specific question about your health. So, come on, let's open up that toolkit and see what's inside.
All right, first up, let's talk about the real detail-oriented tools. These are the intraoral X-rays. Think of them like the magnifying glasses of the dental world, designed to get a super close-up look to find the most common problems.
Now, if you've ever had a routine checkup, you've almost certainly had a bite wing x-ray. It's called that because you literally bite down on a little tab, or a wing, to hold it in place. Its mission? Well, it's simple but absolutely crucial. It is the #1 tool for finding cavities that are hiding out between your teeth.
So yeah, this little image is a master of detection. It's not just looking for those sneaky cavities, which are called intraproximal caries, by the way. It's also checking to make sure your bone levels look good for healthy gums, and it's double-checking that any old fillings or crowns you have are still fitting perfectly.
Okay, now let's meet the bite wing's partner in crime, the periapical, or PA for short. So while the bite wing looks between the teeth, the PA's job is to look at the entire tooth. And I mean the whole thing, from the very top you chew with, all the way down to the tippy tip of the root, and even the bone that's holding it in place.
This is the image your dentist needs when they suspect there's a deeper problem. If you've got a nagging toothache, they're probably going to take a PA to check for an infection or an abscess right at the root. It's also the go-to image if they're planning a root canal or trying to figure out if a tooth's root might be fractured.
So, let's put them side by side to make it super clear. It's really this simple. A bite wing is for finding cavities between your teeth. A periapical is for investigating problems with the entire tooth, especially down at the root. Two totally different tools for two very different but equally important jobs.
So it really just boils down to this, you know? If you need to find a sneaky cavity hiding where you can't see it, that's a job for the bite wing. But if you're worried that a toothache might be a nasty abscess, well, you're going to need a periapical to see what's happening at the root.
Okay, so we've seen the close-ups. Now, let's zoom out. Sometimes dentists need to see the whole forest, not just the individual trees. For that, they use extraoral X-rays. These are images taken from outside your mouth to get a broad look at your entire jaw.
This is that one. You know, the one where you stand really still, bite on a little plastic piece, and a big machine slowly rotates all the way around your head. The result is pretty cool. It's this amazing widescreen picture of everything at once. All your teeth, both your upper and lower jaws, even your sinuses. It's like a landscape photo of your face.
A panoramic's real strength isn't in those tiny, fine details. It's about seeing the entire system working together. This makes it absolutely perfect for things like finding out exactly where those tricky wisdom teeth are hiding, or for an orthodontist to see how a kid's jaw is developing. It's also great for spotting bigger issues, like cysts or even a fracture in the jaw.
And this is a really, really key distinction. Because it's a wide, sweeping view, a panoramic image has to sacrifice some of that fine detail. So it is absolutely not the right tool for spotting those little cavities between your teeth. For that, you got to go back to our cavity detective, the bite wing.
So we've seen the 2D close-ups and the 2D wide views. But what happens when 2 dimensions just isn't enough information? Well, now we get to talk about the absolute gold standard in modern dental imaging.
Okay, get ready for this. Cone beam computed tomography, or CBCT. This isn't just a flat picture. We're talking about a full 3-dimensional model of your skull. It works by taking hundreds of little pictures in a single scan, and then a powerful computer stitches them all together into a 3D view that a dentist can spin around, slice through, and measure with just incredible precision.
So why is this so powerful? Well, let's take dental implants as an example. With a regular 2D X-ray, you can see how much bone height you have, but you can't see the width.
A CBCT scan lets the surgeon measure the exact height, the exact width, and the density of the bone. They can see exactly where sensitive things like nerves are. This completely transforms implant surgery from a very skilled guess into a digitally planned, ultra-precise procedure. It's a game changer.
And that's why CBCT is reserved for those really complex situations where precision is just, well, it's everything. We're talking about planning for implants, navigating tricky oral surgeries, or any case where understanding the exact 3D relationship between teeth, bone, and nerves is absolutely critical for a safe and successful outcome.
We've seen the whole toolkit now, the close-up detectives, the wide-view surveyors, and that 3D super scan. But there's one guiding principle that connects every single one of them, and it all comes down to your safety.
In all of medicine, actually, the guiding rule for any kind of radiation is something called the ALARA principle. It stands for as low as reasonably achievable. And what that means is you always use the absolute minimum amount of radiation exposure you need to get the information required to treat a patient properly. No more, no less. And that brings us full circle. The reason there isn't just one X-ray to rule them all is because of ALARA. A dentist chooses a bite wing for a cavity check because it's a very low-dose, super effective tool for that one specific job. They only move up to a higher exposure image like a CBCT when the question is much more complex and it just can't be answered any other way. It's a calculated, careful decision every single time.
So, the next time you're in that chair and they bring out the X-ray machine, you're not just a patient anymore. Now, you're an informed partner in your own care. You get the why behind each image, you know the difference between a cavity check and a root inspection. So the real question is, what are you going to ask at your next visit? Thanks for joining me.